Hi, I'm Dawn Damari, and you're listening to and watching another episode of A Teaspoon of Healing podcast. So today I am happy to have a guest here, Dr. Julie Siemers. She has been a nurse for 45 years. She's a patient safety consultant, an industry nurse leader, and educator. Hi, Dr. Siemers. Or do you prefer if I call you Julie or Dr. Siemers?
Julie's fine. Yeah, I think it's just conversational, but thank you for having me on your show. I appreciate that.
Thank you for coming on the show. And you are also the founder of Lifebeat Solutions and the author of the best-selling book, Surviving Your Hospital Stay, A Nurse Educator's Guide to Staying Safe and Living to Tell About It.
Yes.
That's really, we're going to dig into that topic. I'm excited about this interview. So do you mind telling the people who are watching or listening to this a brief overview about you and what you do?
Yeah. So I started in nursing right after high school. My mom said when I was trying to figure out what to do, because she always wanted to be a nurse. Why don't you be a nurse, Julie? And it just really resonated with me. And it's a path I'm so grateful that I took so many years ago. But I was in practice for probably 30 years, at the bedside, taking care of patients in the ICU, the trauma center, and then spent 12 or 10 years on the helicopter as a flight nurse. And then I got into nursing education in 2009 because I really wanted to help educate how nurses can be better nurses instead of just getting on the sidelines and saying, oh my gosh, these nurses don't know what they're doing. And that's when I started my research into my doctoral topic, which is patient safety. And that just became this burning desire for me to help patients and their families. When I found out that medical error is the third leading cause of death, I was stunned. I never knew that as a nurse. And I thought, if I don't know it, then many other health practitioners don't know it. And if we don't have awareness, we can't solve the problem.
Wow, I didn't know that it was this third. So medical error is the third cause of death while you're in the hospital or just in general.
Heart disease, cancer, and medical mistakes.
Wow. And that's really amazing. Yeah, I'm a registered dietitian, as a healthcare professional. I wasn't aware of this. And so that means a lot of people out there in the general public are not aware of it, and patients. So, wow. And I grew up, my father was a doctor. He's retired now. My mom was a nurse. They're both retired. So hopefully they're listening to this too. So I don't think they're going to find this interesting. And so again, you wrote this book, Surviving Your Hospital Stay, A Nurse Educator's Guide to Staying Safe and Living to Tell About It. So, we never know, of course, when we may end up in the hospital. Some of us might be having surgery done in the near future where we may have to stay overnight, or we may have a chronic health condition. But many of us, we could just get into an accident, you can get in the ER, and then you could be admitted. And so as well, many of us have loved ones who will have to spend time in the hospital. So first of all, about ourselves. So in general, what should people expect during a hospital stay that they might not be aware of?
I guess I want to preface this whole conversation by saying, as you did, that we're all going to be a patient someday, or our family members or loved ones. And so the time to prepare to have the best experience possible is now, not when you're in the middle of a crisis, getting a diagnosis or some accident happening. And so the healthcare system is complex, as you know, and many people know that. It's confusing. It's a different language. Medical terminology is like, oh, what did you say? When the doctor or nurse is trying to explain congestive heart failure or medications or even diagnostic exams, et cetera. So that's honestly why I wrote the book, is to help patients have really a guide for what should I know. So there's chapters on how to pick your hospital. And I say that because even as a nurse, I did not know this, but there is a nonprofit organization called Leapfrog. And there is a website sponsored by Leapfrog that is hospitalsafetygrade.org that anyone can go on as public knowledge, put in the zip code of where you live, and find out the ratings of the hospitals in your area. So it's safety ratings. And there's 22 categories and subcategories, and the hospitals are rated A through F, just like college or high school grades. And so you can dive in and say, why is my hospital a D? And you could look at all the categories and say, well, wow, they don't do very good on hospital-acquired infections. They don't do very well on blood clots after surgery, specifics on that hospital. So it's really a resource guide for patients and their families. If you're having surgery, there's a chapter on what should I know? What's informed consent? Should I sign that with the nurse? No, it should be a doctor, those kinds of things.
Okay. And the website again is, I think you mentioned Leapfrog.
It is called hospitalsafetygrade.org. And I can send this to you. You can put in the show notes.
Okay. Yeah, great. Hospitalsafetygrades.org. That's really important.
Mm-hmm.
Grade.org.
It is.
I'm going to look up the hospitals near me. I'm curious because, as you said, all of us will be a patient or we'll have a loved one in the hospital. And, it's really scary. I actually haven't worked in a hospital. I'm a dietitian, but I did do my internship. This is a second career for me. So I did my internship. Part of it, the clinical part in a hospital. And it was really eye-opening, still growing up in a medical family, but really working there. And, I could kind of see, I definitely noticed when we talk about loved ones, that when somebody has somebody there to advocate for them, it's really important. But so when let's just say a listener, they end up in the hospital or they will end up in the hospital, what should they know? How can they mitigate potential harms? Like maybe what are one or two things that could go wrong?
Well, communication is essential. And I say that because even the Joint Commission says that 70% of patient harm events are due to communication breakdown. So that's either between the healthcare team themselves or the healthcare team and the patient and their families. And understanding and knowing that, it really not only empowers us, but obligates that we communicate with the healthcare team, i.e., let's just say, for example, your mom is not acting like her normal self. The nurse or the doctor may not know that's not normal for your mom. And bringing that up and saying, I'm concerned. In fact, my TEDx talk that came out a month ago, that is one of the tools that I shared. And it's the cuss words. And that's to get the attention of the healthcare team when you're concerned, uncomfortable, scared, or there's a safety issue. And so when you use any of those words, it is really with the intention to say, hey, I need some help here, either for myself or my loved one.
Okay. And so you had mentioned communication. And I haven't really spent too much time in the hospital except for when I have my children, and I don't remember being on any medication, but I know that a lot of patients, when they're in the hospital, they, have pain medications and, those can make you pretty out of it. Right. And if you don't have a loved one with you, either at the time or at all. So, how can someone advocate for themselves when they're given those pain medications, which can be more difficult to communicate with the team?
Yeah, it is really honestly about asking questions, and really don't be afraid to ask, because there's times where when I was a nurse at the bedside, patients would say, oh, that doesn't look like my normal blood pressure medication. Did the doctor change it? And then the nurse should go investigate. Or it's a blood thinner, but I'm already on a blood thinner. Am I supposed to be taking 2 of them? Mm-hmm. Oh, no, let me go check. And it really is that communication back and forth between the two of you. If you've had pain medications or anti-anxiety medications or sedative medications, you're not going to be your 100% self, which is why if you can bring a family member with you or a friend is my high recommendation.
Mm-hmm. Yeah, I definitely noticed that my brief time working in a hospital, the people who had a family member or a friend, an advocate, sometimes I would just end up having to talk to them, about dietary, questions if the patient was out of it, even if they weren't unconscious or, sleeping. So if you do, when you have a loved one in the hospital, so what are some things you can do to ask the team so you can make sure that you know what's going on?
I would definitely take notes. Okay. And this isn't for litigious reasons. It is really to keep track of things, because there may be a physician come in the room. A lot of patients nowadays have several physicians, a cardiologist, a nephrologist, an internist. And sometimes they don't read each other's notes, or sometimes they don't agree with each other. And so really it's keeping the healthcare team kind of aligned also, just by saying, hey, and again, out of curiosity, not being confrontational, is just asking those questions. But this doctor said this, and that seems different than what you're saying. Can you help me understand? That's another tool that I teach is the 3 Ps, which is be present, be polite, and then be persistent. High anxiety occurs around healthcare situations, especially if you're in pain or, you're really concerned about the diagnosis you just got. And it's easy to be on edge and anxious. And so just remember to be polite. That goes both ways, of course, with the communication. But if you don't get resolution to your concern or you're being uncomfortable or you're scared, that's when you need to be persistent. Don't just go back into the corner in the chair and just, be quiet. That's when you need to escalate. So the chain of command in a hospital is the nurse, the charge nurse, the house supervisor, and then the administrator on call. So there's always another level if you're not getting the interventions or action that you feel you're still really concerned about your husband or your wife or your child.
Okay. I like that, the 3 Ps, and definitely being polite too, because, you can, what does that one say? You can catch more flies with honey than with, I forget what the other thing was, with being bitter, right? Yes.
Yeah.
And that's really important too, to being polite and balancing it with being persistent at the same time, which is not easy to do.
Right.
It's not easy to do. Yes. And so are there any particular questions that a family member should ask the medical team, maybe the physicians or the nurses? I know when the physicians come in, everybody's busy, but it seems like they were only in there a short time. It seems like a lot of the contact, of course, is with the nursing team. What are a few things that they should ask when you're advocating for a loved one in the hospital?
Yeah, we talked about medications a little bit. Nurses are taught, just so everyone knows, in school for safe medication administration, the 5 rights: the right patient, the right drug, the right route, whether it's in the IV or oral, the right time, and the right dose. So those things really are supposed to be checked, with every single administration of a medication. But the other thing really important to know is don't assume, even if you're not in the hospital, but you went and got lab work drawn or you went and had a biopsy, any diagnostic test you should have access to in your electronic medical record. I would look, and they always will give a range of what's normal, but I would not wait for your physician to call you, or I would not assume it's normal because you don't hear back. Mm-hmm. Sometimes, unfortunately, things fall through the cracks and nobody gets notified of really important results. One of the stories in my book is about a man who had a brain tumor. The surgeon after said, "Don't worry, it looked benign." Well, the pathology report did not come back benign, but nobody contacted the family. And so 6 months later, when he's got returning headaches and they take his CAT scan and they see a tumor the size of the surgeon's fist, then they found the pathology report. So unfortunately, the treatment then for the cancer was too late.
Okay, so definitely looking at all of the reports you can, like you have a patient portal and you can see all of that. And, even if if you're getting lab work, say you're not in the hospital and you're getting lab work and you didn't get a call back. So is it okay just to reach out to the care team with a message? Sometimes in those portals, you can send a message and say, I noticed this on my, my LDL is high. Is this something to be concerned about? Would you suggest that people do that? Okay.
Yeah.
Okay. Yeah. And I know this is a little bit kind of a negative question, but what are a few things that can go wrong in the hospital that can get pretty bad? I know we mentioned medications.
Yeah, medications is the number one error that occurs. I think it costs the healthcare industry $40 billion a year for the mistakes that are made because of medication errors. But, yes, it is kind of scary. And yes, we don't want to be pessimistic, but I look at it as the more informed, aware, and educated that we are, we can intervene. medical system, like I said, is so complex and so many things can go wrong. But, honestly, if the aviation industry can send an airplane 8 miles above the atmosphere, 80% of the speed of sound at 1/4 of the air pressure on the ground or the atmospheric pressure on the ground, and really pretty much take off and land 10 million times a year safely,
Mhm.
then we can do better in healthcare too. So I think knowing that surgical instruments or foreign bodies like sponges can be left inside inadvertently in the body after surgery. And some people say, oh, well, doesn't that just happen on TV? No, unfortunately, it doesn't. A friend of mine just last 2 weeks ago, her mother in law had to go back to surgery a week later because of continued abdominal pain and now signs of infection. They had left a 6-inch retractor inside her abdomen.
Oh my goodness.
So, unfortunately, it's not just a freak thing. It happens often enough that we need to be aware of it. So, if your family member had chest surgery and the pain is now 3 days later worse than it was, or now they're showing signs of infection, those are all things to be aware of and insist somebody needs to take an x-ray and see what's going on my dad's chest on that left side or something like that. The other mistakes that can happen is wrong site surgeries. About a month ago, it came out in the news, a lawsuit, of course, that a man was supposed to have his right knee replaced. They inadvertently did the left knee instead. So just knowing those things and having a conversation with your surgeon. How are you going to ensure that my correct knee is operated on? Or how are you going to be sure that you take out my left kidney that's diseased and not my right one that's healthy? There are surgical checklists, but it's not mandatory to use those. And I don't know why, other than it takes a few extra minutes, that people don't use them. Surgeons are usually the ones that say, we don't have time for that. So that would be a question you can ask your surgeon also. Do you use a safety checklist? Just like pilots, every single time, it doesn't matter if they've flown 10 flights or 10,000, there's a landing and a takeoff checklist. It's mandatory.
Mm-hmm. And so there's also a surgery checklist that, like you said, sometimes they're pressed for time, so they might bypass it.
Yes.
Okay.
And that's when mistakes can happen.
Yeah, for sure. It's actually really scary. It is really scary because, and we are humans and surgeons are humans too. So sometimes errors do happen. So that's why it's really important to communicate, like you said.
Yes.
And ask those questions.
I think another one to make the audience aware of is healthcare acquired infections. Mm-hmm. The number one, easiest, simplest, most effective way to prevent spread of infection is hand washing. Healthcare professionals, nurses, doctors, pharmacists, phlebotomists, everybody learned that in 101 fundamentals, right? But you'd be surprised how many healthcare providers come in the room and do not wash their hands. Okay. So as a family member, speak up, or even as a patient, say, good afternoon, Dr. Jones or whatever. Happy you stopped by. Can you please wash your hands before you come over here and touch me? And they may get offended, but on the other hand, we know that 1 in 31 patients every single day acquires an infection in the hospital. Those are really poor odds, right?
Very.
And so I think if we're going to change the culture of healthcare, it has to start with us. Yes, providers and professionals, but also with family members and patients themselves. Just saying, this is what we expect. We expect to be safer. And this is something you can do to help out.
Sometimes people forget to wash their hands. They're busy and they think, oh, it's going to be fine. Or I'm not going to touch anything. But it's really serious. And those are really serious, those hospital-acquired infections, especially in the elderly population where they don't have the immune system to fight off these infections as much as a healthier, more robust person. Or anyone, honestly, who's in the hospitals, usually their immune systems are lower. And that's really scary. So you suggest just asking whoever it is to please wash your hands.
Yes.
And not worry if they're offended or not.
No,
because they shouldn't be.
Yeah, they shouldn't be. And here's the risk. and maybe this can give you courage if you're scared to speak up. If you don't, that family member or yourself could be at risk. It honestly can be the difference in life and death in some situations. And you don't want your fear to contribute to, I should have said something, and now maybe mom would be alive, or maybe now mom wouldn't have that infection, that now she's going to extend her hospital stay and need another surgery, etc. So just think about that.
For sure. That outweighs the temporary, momentary discomfort of maybe offending somebody on the medical team and just asking them to please wash their hands. Yeah. And even if they say they did it, they could just do it again. It's not going to hurt.
I want to see it.
Yeah, exactly. And now something with hospitals and just healthcare systems in general, the staffing is an issue. I know that, of course, during COVID and after, it became an issue, and it still is. So does this staffing issue, does this also impact the potential for medical error?
Oh, absolutely. And that's why, again, I think we need to have that partnership between the healthcare team and patients' families. Patients' families can be the extra set of ears and eyes. And the healthcare team really should be receptive to, hearing that, again, mom is not acting like herself. There is part of my research that I did, and I was surprised to find that before a patient goes into an unexpected cardiac arrest, meaning they become so clinically unstable that now, they go into cardiac arrest and die, those physiological signs of deterioration. So neurological changes, mom's confused if it's more than 10 minutes is kind of the guideline we use. She wasn't this morning and now she is, and she's not the same. Heart rate or vital signs, respiratory rate. 80% of nurses don't count the respiratory rate. It's supposed to be a part of the vital signs. And it is on the chart, but they'll usually just write in a number that they think. But the respiratory rate is the physiological sign that's the earliest and most sensitive indicator of impending clinical instability. So it gets too fast when a patient's trying to get more oxygen at the cellular level. It gets too slow, usually because of medications like opioids, pain medications, etc. So it's really an important vital sign. All of those physiological changes happen 6 to 24 hours before the cardiac arrest. That means that's plenty of time to notice, to pay attention, to dig into the why. If grandma's heart rate's 100 an hour ago and now it's 110, something is wrong. Mm-hmm. And we need to figure out what it is.
Absolutely. Yeah. And with lack of staff too, people are taking on a lot more patients too. Nurses, doctors, phlebotomists, everybody's taking on a lot of patients. So, and they're also probably a lot more fatigued. So it's probably even more critical to really advocate for yourself or for a loved one because of this.
100%.
Now, as a healthcare professionals, what can they do to ensure that these errors don't happen? Even if it's not a physician, just pretty much anyone working in the system, how can they make sure that they aren't contributing to errors?
Listening. It is a two-way street. Communication is a two-way street. So listening to the patient and their family members. I always appreciated when the daughter was there or something and said, this is my mom's typical, or my mom's done this before and this is what we did, or, just some insights into that individual. We know patients react different to different medications, to surgery. I think the benefit of having a lot of experience as a nurse or a physician or any healthcare provider is you learn to connect the dots and say, I've seen this before. Patient's heart rate is 110. Did I address pain medication? Is that the reason? Or are they dehydrated? Or are they getting an infection? And then just really working together as a team to communicate.
Yeah, that's really important. The communication and definitely the listening, making sure we listen to the patients. And, it really shouldn't have to be said, but, sometimes it does. People get busy. So it's just to remember to stop and really listen, really listen.
Yeah.
Again, the title of your book, Surviving Your Hospital Stay, A Nurse Educator's Guide to Staying Safe and Living to Tell About It. So, yeah, maybe tell the listeners a little bit about your book and what prompted you to write it and what inspired you.
So it has 30 stories in the book. They are all true, unfortunately. Most of the patients did die in the book. But I wrote it that way because I relate to stories, and I think people do too. And it's just an opportunity for someone to say, oh, I could be in that situation, or hey, that's what's going on with my dad right now. And it just is a way to, again, inform and educate. It's broken down into chapters. How to pick your hospital, how to pick your physician, communication, what a rapid response team is, so that you know if your family member is starting to deteriorate clinically, that there is or should be a rapid response team at the hospital that can come in and assist quickly to prevent that cardiac arrest. But I really wrote it because I saw so many patients and their families struggling with not knowing what to ask. What should they know? And again, it just came from, my nursing education background, as well as observing patients and their families, and just trying to provide a resource that can close the huge chasm that exists between most people don't even know, like we talked about before, what they should know, or medical terminology. Well, what does that mean? And what are my rights as a patient? And your rights are that you have medical information that you understand. So if the doctor, says, your mom's got congestive heart failure, we need to do an echocardiogram, I'm going to put her on a diuretic, and then they leave, and you're like, what? So it's just saying, can you please translate that? What does that mean? And honestly, they should take those few minutes to be able to explain it, and then give you options too in treatment plans.
And that's really important to the medical team should know to use the plain layperson's language for that, because that is one thing that throws a lot of people. They hear those terms like you had mentioned, and it's like, what? They really need to be able to explain what that is to the patient.
I think it's important to understand too that physicians get different education at different hospitals and different medical schools. So you may get a different opinion from a second physician. If you're not feeling comfortable with what your doctor tells you, or you want more information, I definitely recommend getting a second opinion. Medical knowledge doubles. I think it's less than every 3 years right now. And most physicians, as you said earlier, and nurses included, are so busy to try to keep up on the latest knowledge. Evidence-based research is challenging and difficult. But I also, on the bright side, feel we're so blessed and fortunate to be living in a time where we've got answers at our fingertips. And for those of you who aren't familiar with AI, yes, there are a few drawbacks, but I think there's a lot more benefits of learning to use a simple ChatGPT to say, my doctor put me on a blood thinner. What should I watch for? Mm-hmm. And you should get an answer that says, watch for bleeding. If you're brushing your teeth and notice bleeding gums, if you urinate and notice some blood in your urine, or anything like that. And then you can, again, help educate and inform yourself to be a healthcare participant that is not so scared.
I really like that. Yeah, because it's really useful, the ChatGPT, for explaining those things. And no, I really like that. And not to be afraid of it. Yeah, AI is definitely going to make changes, probably a lot within healthcare too. It'll be interesting to see. And now you're also the founder of Lifebeat Solutions. So yeah, what is that? And what do you do with that, with Lifebeat Solutions?
It is courses that I developed for nurses that are already licensed and in the hospital, mostly based for acute care. What I learned over my nursing career is that even though we try to do a really good job in nursing schools, it's really fast and furious. We have, most schools now are a 3-year for a bachelor's program, which is a 4-year degree. The bachelor's in nursing is the second hardest bachelor's in the country. First, we have engineering, and then we have bachelor's in nursing. And then we take that and we cram it into a 3-year time frame. And they're really leaving school not prepared for practice. In fact, there's a nonprofit agency called ECRI, ECRI, a year ago, March 2024, said the number one patient safety concern is that the graduates from healthcare professions are not prepared for practice. They're not safe and they're not ready. Just recently, I say it's recently in 2021, there was a follow-up study. So this was the third one, taking over 5,000 newly licensed graduate nurses and putting them through a competency-based test that's over 5 hours. So part of it was written, part of it was in a simulation lab. And they found the practice ready, safe, and competency fell from 35% in 2006 to 23% in 2016. And in 2021, it's only 9%.
Wow.
That means, again, those nurses really need our eyes and ears as patients' family members to help them because they really struggle. Yes, there's some great ones. And part of that problem, too, is, as you said, during the pandemic and COVID, so many nurses with experience retired and just said, I'm done.
Yep.
And so now we don't have preceptors and mentors out there. When I went through ICU training, I had several mentors that had 15, 20 years experience. They're just not around anymore.
Yeah.
So it's a scary time. But again, I'm trying to provide those tools or resources. So the courses are to re-educate those nurses or educate in some instances of concepts that they have missed in school or didn't learn how to apply those concepts to help keep patients safe.
That's really great that you do that. And that's such a wonderful resource. And hopefully that, a lot of nurses will take advantage of that, especially like you said, right now, with a lot of the mentors and preceptors who have quit or retired during the pandemic, it leaves a big gap. So that's wonderful that you're filling that gap. And so how can people get in touch with you if they want to learn more about your book or Lifebeat Solutions?
Yeah, my website is drjuliesiemers, SIEMERS.com. I have blogs on there. I'll have ebooks soon. I've written them. There's a patient safety checklist on there. And all my socials, drjuliesiemers. I do a TikTok almost every day, and I talk about relevant issues, what's going on. If your dad's having surgery, here's 3 things you need to know. And then I also put that same content on Facebook and Instagram, and those are my same, drjuliesiemers. But yeah, the other thing I'm adding to my website is patient stories. I really want to share and help people. Just one that comes to mind is one I read a while ago was near-death experiences, because I thought it was fascinating, what happened with patients when they supposedly cross over and then come back, et cetera. And I just think that stories is how people learn. So I'll be adding that to the website coming soon.
Yeah, I'll have to check that out. I definitely find that the near-death experience too, that's really fascinating. Really fascinating. Yeah. It really is. Well, thank you so much, Julie, for coming on the podcast. I really enjoyed this conversation. I learned a lot, and it's very eye-opening. It's very eye-opening. I'll keep things in mind too. Just, we never know, like we said at the beginning, when we could be a patient or a family member could be a patient in a hospital.
Right. And thanks for having me. I hope that your guests and your listeners learn something today, even one thing. My goal is to change the healthcare of patient safety. And if I can save one life by someone learning something, whether it's speak up or ask questions or, then yeah, I'll be happy.
And you will, definitely. I know people will take a lot from this. Thank you so much for sharing.
You're welcome. Thank you.
Right. Thank you. I hope you have a wonderful rest of your day.